If you are someone who is going through perimenopause or menopause, if you are taking hormone therapy, or if you're not taking hormone therapy, but if you want to empower yourself with some science-backed information on how lifestyle strategies can help you to reduce your symptoms and go through this journey with more ease, then please check out my conversation with Dr. Ginger Garner. Hi, everyone. Let's welcome Dr. Ginger Garner to Vishoka Clinic today. She's a physical therapist. She practices orthopedic and pelvic health, both. She owns a clinic in North Carolina and it's called Garner Pelvic Health. She's also founder of Living Well Institute, where she offers several professional courses for many different health professions. And she also offers many public classes to help everyone. And she's author of multiple books. One of my favorite books of her is Medical Therapeutic Yoga and also Integrative and Lifestyle Medicine. And she is mom of 3 boys. So she's doing everything possible.
So I have to stay hydrated.
True. Welcome, Ginger. How are you today?
Thank you so much, Vidhi. Thanks for having me. I'm glad to be here. So thank you.
So, Ginger, let's dive right into it. And I wanted to start with lifestyle medicine, integrative lifestyle medicine. So, tell me how it is different than ACLM certification, because so many times I hear that people get confused between these two. So, I want to just start off with clarifying and then we can go in more details.
That's a great question. I did do the ACLM, American College of Lifestyle Medicine, board certification back in 2019, I believe. Back in the teens of the 2000s, which seems like 2 days ago. But I went through that process and it was really eye-opening. It was educational. Met a lot of wonderful people. I was able to found the first member interest group for PTOT, or the member interest group for that. So, and I work with a lot of wonderful people there. And what I learned along the way, in studying for that exam, that certification, was it was, for better or worse, very physician-centric. And so while we practice differently, our scope of practice is different, it made sense to create something that would really speak to PTOT specifically. And even, and I can only speak to the PT side of that. I know it's very relevant for occupational therapy as well, but as a PT, we have a certain scope of practice that varies state to state. We are not medication prescribers, and a lot of the things that would be oriented towards lifestyle medicine could have that context. Things that we wouldn't necessarily use, but then we would have more time on the other side to do other things with the pillars of lifestyle medicine. So sleep, nutrition, the science of those, stress management, physical activity, avoiding, environmental pollutants, all of those things. We are unique in that we get additional time with them. I felt that we needed more background in other areas, while physicians, physician assistant, nurse practitioners, their strengths would lie somewhere else within the context of lifestyle medicine. So that's where the certification that I created was born from. It was out of a need to really target what PTs and OTs need. And the reason is because both the professions already embrace lifestyle medicine. And there's a story behind that too, because I worked on that, getting that position statement passed through House of Delegates in 2018, the year prior, so that it would enshrine in our scope of practice in the United States the practice of both integrative and lifestyle medicine. Fortunately, there have been other position statements that also support the practice of lifestyle medicine, which then underscores that we have the foundations and the scientific knowledge to practice integrative medicine, to practice lifestyle medicine, that we don't need to have an external recognition by another certification. So we don't really need to sit for other board examinations because it's within our scope, which then frees us up to do certifications like the one that, I created, because I don't feel like physical therapists should have to go, and it becomes very expensive to chase every single, like, we call it alphabet soup, right? Where you have like 15 letters behind your name, and it's hard to discern what they mean. I want PTs to be able to graduate and realize that just with some continuing education courses, that they can practice this too and be really successful at it, that they don't have to be member of 4 different organizations and chase all of those things down. So that's kind of the difference between ACLM and the program that I teach.
And thank you so much for creating that, because I have done your ILM certification and I loved it. And that really changed my life, like personally and professionally. And if we can talk about what does integrative lifestyle medicine do and why should one care about it?
Yeah. Well, I guess the story starts when I was doing when PT was a master's. I think I was the second class of master's level degree training. That was in 1996. And I started the semester, one semester turns into two, and I was becoming kind of disenfranchised, just kind of disillusioned with the profession. And I haven't even practiced yet. I was still a student, right? So I looked on all the course offerings that was at the program that I was at, and not a single one of them addressed any of the things that we're talking about now. There was no integrative medicine or therapies. There was no lifestyle interventions. It was, got a rotator cuff tear, got an ACL problem, had a stroke. This is what you do. I really felt like we still were being taught to be kind of glorified techs. Give them some movement, but there was nothing about stress management, nothing about nutrition. And the reason it was on my radar is because I had already been studying yoga. And a couple of years later, I would pick up Pilates as another kind of mindfulness based somatic therapy. And I was also an athletic trainer. I was already licensed as an athletic trainer. We get classes in nutrition. We talk about sports psychology. And yet there were no psych informed practices. And there was nothing about nutrition in PT school, nothing about sleep science. And I thought, wow, this is really off. If other therapy fields, like sports medicine and athletic training include this, why don't we? And I was just given a big shrug, like, we don't do that. In fact, I was directly told by the then director of the program, we don't do that. You need to go to the School of Public Health to learn this stuff. I was like, wow, this is terrible. This is terrible. So I went to my advisor. Of course, I wasn't dry-eyed then. Like, I made it out of out of the office, down the hall, stopped in my advisor's office. I was so upset, not angry. I was, crying. I was upset. And she was like, ignore that advice. There are going to be plenty of people that will tell you that you can't do this. Let me help you get into the School of Public Health, because it's not like you could create a curriculum that didn't exist in the PT school at that time. And so that's what I did. I ended up studying in the School of Public Health. I had a great experience there, and it really broadened my horizons with what we can do as agents of public health. And that's honestly what I think we are at our core. And I think we just have gotten separated from that with all of the necessary requisites that CAPD has for programs, and you've got to put all this stuff into the curriculum, but none of it included prevention. And of course, fast forward nearly 30 years, and well, that's what the textbook Integrative and Lifestyle Medicine and Physical Therapy was. Joe Tata and myself pulled in dozens of experts across the realm of integrative and lifestyle medicine and said, look, you're PTs, this is in our scope. We've all been practicing this for decades. We need a textbook to just, again, enshrine that. And so I feel like that integrative and lifestyle medicine is an inherent part of what we practice. I believe that it has always been a part of what we practice, even if some programs like the one that I went to didn't acknowledge it and said that it had no place there. It did. It did have a place, and it does have a place. And now it is enshrined in our practice. It is part of what we can legally do. And it's so incredibly important that it's not optional. It's not optional to include sleep science. It's not optional to talk about nutrition or psych-informed practices. It's not optional to talk if someone's a smoker, a heavy drinker, or lives in a place where there's not a lot of green space and there might be air pollution. It's our responsibility to talk to them about that. And what integrative and lifestyle medicine really is and does, of course, there are categories for lifestyle medicine. There are categories of integrative medicine that get a little bit more into the weeds. But when you step back and look at the 40,000 foot view, Integrative and lifestyle medicine probably enjoys more evidence base than anything else that we have, more than the surgeries that we do, more than the medications that we end up prescribing as a medical community and collective. Lifestyle medicine has a giant body of evidence base to support it, as does integrative medicine. And I don't want the audience to confuse it with alternative medicine, because alternative medicine is something that's adjunct to your healthcare interventions and treatments, but it isn't supported by the evidence base. It may be more anecdotal, experiential, but it is only kind of a sidebar to the evidence based practices. But both integrative and lifestyle medicine are evidence based supported practices that the World Health Organization, the CDC, NIH, and many, many, many researchers have found is well supported. So, in terms of what it can do, to finally get to your question, in terms of what it can do, it changes your life. If you're concerned about longevity, if you want to make it to 90 or 100 with a high quality of life, you can certainly make it to 90, but not with a high quality of life. Typically, the last 20 years of your life are going to be spent worrying about medical debt, paying high deductibles because you need so many procedures done, or you need pharmacy, you need multiple medications or surgeries. But if you look at blue zones, which is kind of the foundation for lifestyle medicine, if you look at those countries and areas of the world, those people who embrace lifestyle medicine and value it, those are the people that we look to, because those are the people that are out hiking at 90 years old or still lifting weights.
Yeah, it's so amazing because before I did your certification, I was just, like a regular physical therapist. The treatment was always like pain centric.
Right.
And after that, it completely changed the way I started to look at my patients. Now I just look at the whole person, not just that one diagnosis, not just like shoulder, joint, or back pain. And it feels amazing. And it's very, I would say, like satisfactory to empower patients with, of course, during the treatment, like the time that we spend together in the clinic, which we will, of course, do our traditional physical therapy, but then educating them on this like four pillars of health, which is, of course, nutrition, sleep, stress, and then physical fitness in the clinic. And again, like outside of the clinic, beyond once they're like done with the treatment, they take and carry forward with them for throughout their life all those changes. And it's amazing to see that. And it's also amazing that more and more patients are coming in the clinic having a little bit more awareness than before.
Right. Yeah. They begin to understand that, yeah, they might have knee pain or back pain or neck pain or recovering from a car accident or a surgery, but they no longer just want to address that. If they think at all about longevity. And one thing that may need to change as well as therapists is letting people know that we can do that, but they know they want more than just, post-op abdominal surgery treatment, because they're not digesting food as well. They're not sleeping because they're in pain. And then all of that becomes the lifestyle medicine that can intervene. And I find that probably, well, I can pretty much say 100% of the time, if they have those lifestyle issues like sleep or diet that need to be changed, I usually will change that through an integrative lens, which is why integrative and lifestyle medicine are so synergistic.
Yeah, true. And I know that yoga is also a big part of your
Yeah.
practice as a physical therapist, as a professional. So I want to know, like, when was the first time that you were inspired to learn yoga, and like, where did you learn it from
Oh
back
my
in the
gosh.
day?
Back in the day,
Yeah.
I started doing yoga from, well, multiple sources. And I think that kind of describes my approach to learning, a bit of in a nutshell, because I think I had, at that time, had picked up, a lot of the lineages that existed. And I say that in past tense because Theodore Wildcroft and so many other like really incredible people who did PhD work, did research, did investigative journalism, really uncovered and exposed a lot of kind of the Me Too movement in yoga, where a lot of the lineages were associated with patriarchal abuse of all genders, not just women, but also men, and again, all genders. So some of those are implicated in my early studies. So like going and taking classes with Patabi Joyce, going and studying Iyengar yoga, going and learning about the vinyasa yoga and flow and different types of lineages. So I ended up going to multiple yoga conferences where I was able to be exposed to all of that. And then I started to teach an evidence-based form of yoga as applied in rehab. And everywhere I went around the country, I would drop into other studios. I would go to other teacher trainings. I went to yoga therapy training and in addition to those teacher trainings. And I also sought out individual instructors that I could study a little bit more what at that time was, posturally aligned, kind of a younger type yoga. But I always had, and this is where I have to be like so transparent in my own journey as a woman studying yoga, there were aspects of it that did ultimately align with that Me Too movement. So it felt very vindicating when some of that news started to break, when women came forward and men sharing their stories, of abuse. Because while I wasn't directly a victim of that, I was too close to it and I could feel it. I could feel what was happening in those circles. And so I ended up studying with some of the original teachers from India and then students and their proteges, and they began to take different attitudes towards that. It was not as it was, 60 years ago, very punitive, very authoritarian, very patriarchal, where women weren't invited into those spaces. And if they were, it was just like a side situation where they weren't invited into leadership. And so I'm just thankful for everyone who came before us that was brave enough to speak up, was brave enough to kind of persist and study and help it evolve. And so through all that experience, so there's good in that and there's bad in that, right? Because I met some wonderful people along the way that helped evolve the space. But then it also gave me my own foundation for how I would apply it in therapy. And so by the time that was probably a 10-year evolution. That was about a decade before I then said, I think we actually need to focus on evidence-based application of yoga. And at that time, there's very little research. Because if we think about modern postural yoga, it's only about 100 years old. And so there wasn't really a lot of time to actually study it as, yoga really coming to the United States in the 60s and the 70s and before that, but like en masse, like a lot of people. So I wanted to take what really applied to us in rehabilitation. And that for me meant pain science and stress management, polyvagal theory, thanks to Dr. Stephen Porges, all of the trauma-informed work of other important neuropsychologists as well. And all of that came together is what medical therapeutic yoga became, which is really where the book was born, because I wanted just to be able to honor the origins of where yoga came from, because that's a beautiful thing that it did survive, because there's so much colonialism and just like in so many other areas of the world, to be able to honor the origins and roots, but also evolve it at the same time and create something that would fit the other half the sky, because yoga postures were really created for men and young boys, not women. And we're not small males. So we needed to think about it in terms of, gosh, well, what happens when they're, an 18-year-old young female with endometriosis wants to do yoga? Like, what does that look like? What does it look like when a perimenopausal woman wants to do yoga? We don't have any information on that. Because if you look back at the early texts, there was Iyengar's daughter, Gita Iyengar. There was Patricia Walden. There was so many other women out there doing it, but they were also trying to conform to the way that men had done it, not to say anything bad of them, but they didn't have that scientific background. And that's really all they had to go on. So they're trying to make it fit women as best as possible, which is honorable. But thank goodness things evolved and we have science.
And I have read your book, of course, Medical Therapeutic Yoga. And any PTs or OTs who wants to incorporate yoga in their treatment should read that book and learn, because there is so much information and all the postures are, I would say, not traditional postures, but it has, and you can explain a little better than I can, but it's like evidence-based and it's encyclopedia of yoga for any practitioners out there.
Thank you. That means a lot. It was a labor of love to do that, to write the book. And it came from a place of seeing a lot of women and men who are also maybe more mobile than the average person And it came from observing longstanding yoga teachers in the United States who ended up with hip replacements, like joint replacements, way too young because they had embraced the stretch of yoga. And you know that yoga is not about that. It's not about range of motion and stretching, right? And just like pushing yourself into yoga poses. But originally was more modern postural yoga was kind of born out of that kind of acrobatic sense of how far can someone go, even though that's not the philosophy that I think any person who seriously studies yoga embraces. I think that's what sold books and attracted crowds and made money. So when we get away from that, and we all know that medical textbook writing doesn't make anything. So it's definitely not about the money. I can say that and totally laugh out loud. We don't write medical textbooks for fame or show or making money or any of that stuff. So where it was born from me was, well, this is like a particular story, and I have a dozen others. I would go to yoga teacher trainings, and I would spend my whole time treating the yoga teachers, mostly women with injuries, sacroiliac joint injuries, headaches from, oh goodness, one older woman, the teacher trainer had encouraged her to go into a fish pose, which in its traditional form is rather extreme. It's a full lotus pose with a back bend, and you're putting an axial load on your head, and your arms are wrapped behind you. Yeah, you know exactly what it looks like. And she had torn her dura mater. So she had cerebrospinal fluid leaking from having torn that because they told her if she didn't master that pose, that was the preparation for headstand, and therefore she wouldn't be able to do that. Which, exactly, like,
Yeah, I have like no words.
I know there are no words for that, right? But those are the kind of things that I was seeing, and of people being pushed really far. And I took that on and decided, well, if I can just drop in the bucket, have any kind of influence at all, let me write something and start teaching more continuing education and training healthcare providers on how to use yoga safely, particularly for vulnerable populations. So those are people who are naturally bendy, dancers, gymnasts, people who want to do yoga because they're naturally kind of, quote, good at it, but they end up getting hurt because they're hypermobile. They're naturally hypermobile. Those people who aren't hypermobile, they don't have EDS or generalized hypermobility, issues, then they can usually drop into a general yoga class with, not necessarily a healthcare provider at the helm and have less risk of injury. But those vulnerable populations, bendy young women and men and all genders, prenatal, postpartum, any pelvic pain at all, EDS, any of those populations really needed something more. And so that's where the book was born. So the poses are laid out in terms of not just the safest, but clinically, those are the poses I went to again and again over decades of practice. And so it includes all those poses, the modifications of those poses, and what they would look like if you need to. Let's just say someone had a nerve injury. There are modifications for all poses for that. So I tried to be inclusive of all populations because you don't need a bunch of range of motion. You don't even need to be able to stand to do yoga. I tried to make it accessible for everyone. So that's where the idea for the book.
Talking about being a professional yoga therapist, the first time I was introduced to walking meditation was during your course.
Oh my gosh, yeah.
And since then, I fell in love with that practice. And it's so unique and I just love it so much. So if you can shed a little bit light on walking meditation.
Yeah, so specific to like walking meditation. Yeah.
Yeah.
So I remember recording that practice for the program actually. And just like a personal backstory from me, because walking meditation people have done for thousands of years since humans have roamed the planet, they could take that mindfulness based approach to what they were doing. But I think in our fast paced, communication heavy, constantly connected world, it's easy to get overwhelmed. So it felt like a full circle return to me as a mom. I had younger kids. They were all at home. It was a lot. There was a lot happening, which became even more important when COVID, hit and the world shut down. That every step that I took when I went to take a walk to walk my dog, who I still have, after all these years, and to be able to slow down with her, to slow myself down, to be able to feel the ground. Of course, I think it's great when you can do it without your shoes. But hey, there's been moments in time in my life, like when I was pregnant with my boys, walking without shoes hurt too much because you had the extra 40 pounds or whatever it is. So there's no specific requirements for making a walking meditation successful. Shoes, no shoes. Urban, green space. No pet, pet. You could take the principles of walking meditation and apply it anytime, anywhere, even if it's just a 5-minute walk. Because I think the other thing we do to ourselves is we get too locked in to, well, if I can't do a 30-minute walk, I'm just not going to do it. I don't have time to do it. And as a mom who, has an educational, 2 businesses, educational and clinical, with multiple kids, I get it. I totally get it. And I've done it to myself where I would say, I only have, a couple minutes, I'm not doing it. Fortunately, I think I finally left that cliche behind, finally left that obstruction to practice behind. And now that meditation may be, I've got 5 minutes between getting ready for work and leaving for work. I got the kids off to school. The dog has been handled. What do I do? Do I doom scroll, or do I get on my bathroom floor and just do 2 minutes of the yoga that I know I need to do? So that's how, for me, even if it has to be, that's that kind of more stationary version of that walking meditation, that you can take it with you absolutely anywhere, because movement is anti-inflammatory. Movement is stress management. If I add an aspect, and this is what's unique about, I think, medical therapeutic yoga, is we layer on mobilizations, soft tissue mobilizations, joint mobilizations, we can treat particular diagnoses with what we do. It's very specific, that you can get vagal nerve toning, right? And regulation, not just general stress management. We can improve lung function, and we can improve strength and, if necessary, mobility at the same time. So it really is an all-in-one activity. And maybe I just chose and gravitated towards yoga because it's such a time saver, because it is everything in one. But that's a little bit about how, I use walking meditation personally, and how I give that kind of high-level overview to patients, because I would say the same thing to them. Look, it is everything in one. It can be aerobics, it can be flexibility, it can be strength, it can be power, it can be stress management, it can be decompression, it can be vagal nerve, improving the vagal brake. And I just can't say enough good things about it.
I know, it's like it checks all the boxes possible.
Yeah.
Your brain health, your heart health, as you said, and also it can help your bowel health.
Right.
It could
Digestion,
also, right, and it could be
bone
also,
density.
yeah, yeah,
Yeah.
the bone health. And someone can also use it as a tool for, of course, practicing mindfulness and targeting stress reduction and sleep improvement, all that stuff, but also zone 2 cardio for someone.
Absolutely. I can
Well,
definitely make it a cardio thing. That's probably what I first started to use yoga for. Was I was trying to do pre-med and my degree in undergrad, and I was totally stressed out. And I was the first person in my family to go to college. I was a first generation college student. I had no idea how to manage that. I had no skills. I had no money for college. I had no one encouraging me to help me through. And yoga was a lifeline to do all of those things. And so, from a nervous system regulation, it was stress management, but it was also teaching me to have a growth mindset. I didn't have the benefit of coming from a background that inherently knew how to teach that, because there was just a lot of survival mode going on. And, if you're in survival mode, you really can't, you kind of feel like you're clawing yourself, to the surface of the water, but you never really are proficient at swimming if you're in survival mode. You're mostly just doggy paddling and just trying to not take on water. And so that's kind of the feelings, that I had growing up. And, my family did the best that they could, but that was difficult. So shifting to a growth mindset and learning that can learn the strokes of swimming, right,
mhm.
was what yoga gave me. And it really saved my life in so many ways. And so it is definitely an all-in-one.
And now you're helping so many others, especially, as you said, like women who are mom and who are working, and later in life navigating perimenopause and menopause, where we don't have a lot of time to practice like 5 different things. But then yoga, walking meditation, practicing that even few minutes every day help us check so many boxes, like all in one practice. So it's so amazing.
Yeah, and when moms have to check a bunch of boxes anyway, it's nice not to have to add, I've got to get aerobic and muscle mass and bone density and flexibility and balance and everything, you could just put yoga.
Yeah,
That's one
so
box.
true. Right, just one box.
Yeah.
And yeah, I do want to talk about navigating perimenopause and menopause. So tell me again, integrative lifestyle medicine, how that can help someone navigating this journey of life, because it is, of course, the symptoms are overwhelming, but even emotionally it can be daunting to go through this journey.
Yeah, it is because historically women, and even today, even now, because I see that's probably, I'd say 75% of my clinical practice is going to be helping women navigate perimenopause, menopause, and postmenopause. And there isn't a woman that doesn't come and sit down in my office and say, I've been completely ignored. No one was paying attention to my symptoms. So not only are they experiencing a difficult transition that has been undertreated, historically ignored, but they're being actively medically gaslit even now and told, well, there's nothing we can do for that. We can't test for that. We can't do anything for that. And that's because the vast majority, 80% of residents, when asked, are not, they don't know anything about menopause. But when they get to clinical practice, only 50% of them are uncomfortable treating it, which is kind of strange because if you don't have the background and you're uncomfortable treating it, then what are you telling women? Are they telling women, which is what I hear every day, oh, there's nothing we can do about that? Or here, take an antidepressant, or here's a short-term sleep med, but we don't know what to do past that. I think our medical system of education is broken because I think that the values of integrative and lifestyle medicine are not aligned with what's being taught. What's being taught is drugs and surgery, but they're not being taught lifestyle medicine, and we're not being taught integrative medicine. And so for menopause and perimenopause, there is a lot of evidence that supports the navigation of perimenopause and menopause using that. Because let's just take sleep, for example. If we just talk about sleep and what integrative lifestyle medicine can do, I often will call the approach that I take to it, I use the acronym FILM, Functional Integrative Lifestyle Medicine, because functional medicine is really just short for just looking for root cause, which might mean considering labs or other things that need to be looked at. And then we intervene through integrative and lifestyle medicine. And sometimes plants, nutraceuticals, that kind of stuff. What we eat, because that's part of the nutrition realm. Teas that we may drink, magnesium that might be necessary, during different parts of the life cycle, for example, especially to support sleep. So back to the sleep example. If we just take that and we say, okay, she's going through perimenopause, because that's one of the first things I think that women notice is sleep. Just if sleep was a wagon, the wheels would fall off. Like, so
It's like at
yeah, and then
2 a.m.
you wake up, you're not, that's right. I call that prairie dogging. Have you seen little prairie dogs out west where they'll pop their heads up and look around and they'll go back in their hole? Okay, that's women in perimenopause at 2 o'clock in the morning. They're like, they pop up, they're awake, they're like, I don't know what just happened. And they don't even need to be stressed. They're just awake. And what we do know is that the pineal gland begins to not be as efficient in its production of melatonin, that we tend to be very magnesium depleted, especially if you're a caregiver, because we dump and use lots of stress, use lots of magnesium when we're very stressed out. We do know that it's an element that we tend to be deficient in as time goes by, just like some of the other ones, the big ones, D, B12, calcium, things like that. So as we begin to be deficient in those things, what's replacing them? Because they're elementally important in terms of, like, particularly like magnesium, for example, in over, I think, 250 processes in the body, but they're essential for sleep. So when we look at those things, I will ask often, okay, are you waking up in the middle of the night? Yes. Do you have night sweats? They might. Yes. Which we call vasomotor symptoms. Do you wake up feeling refreshed? No. Do you wake up? Does it take you a while to wake up? Do you wake up feeling tired? Yes. Is it hard to go to sleep at night? Yes. So if all of those boxes are yes, I'll ask, okay, what has anyone done? Well, I went to my PCP and they gave me a med, but it's addictive and I don't want to get hooked on that and I can't use it for that long. And then what am I supposed to do? And I validate their experience and say, yes, if the first thing that your PCP goes to is to give you Ambien and they are not looking at any of these interventions that we're talking about, I feel like that's rather negligent. They're not talking about sleep hygiene, for example. Are they talking about the fact that your core temperature has to be colder and your hands and feet should be warmer when you go to sleep? Are they talking about the ideal range of temperature for sleep is between 65 and 69 degrees? But that in order for your adrenals to wake up in the morning, you actually need to be above 69 degrees. So, do you have a programmable thermostat? Can you program that to go to like 70 or 71, 30 minutes to an hour before you want to wake up so that you'll actually wake up naturally? Cortisol will start to be released and your body will wake up. That will signal the pineal gland to, hey, shut down the melatonin so that you don't wake up feeling groggy. You actually wake up feeling refreshed. And then the liver gets less efficient at handling things. So that's why a glass of wine when you're 30 feels great, and a glass of wine when you're 42 feels terrible because you're not metabolizing it as well anymore. So we talk about the imbalance of progesterone to estrogen, which may mean that you need to, maybe you can still have that glass of wine occasionally, which is recognized as a and harmful substance. So all of those things have to be, in moderation. But we talk about ways to metabolize that appropriately or the impacts of it, which can actually imbalance progesterone and estrogen or increase your estrogen metabolites to a level that's harmful to your health and can be impactful in a negative way to your DNA preservation. And we know that from epigenetics that a single meal, a single night's sleep, all that can switch on the genes we don't want expressed and switch off the genes that we do want to express. So, integrative and lifestyle medicine is such a powerful way to just impact sleep. Now, on top of that, we may have to add particular elements. We know that there is melatonin in certain foods, right? We know that we want to have a magnesium rich diet. There are also simple amino acids and things like magnesium that can be taken as an adjunct because in the evidence base, around 400 to 600 milligrams of something like magnesium glycinate can go a long way towards replacing what we begin to lose in middle age, which, by the way, can start as early as 35 years old, because that's when perimenopause can begin. Or an amino acid like L-theanine. That is a building block of protein. It's also known to induce states of calm and relaxation that support sleep. And none of those are addictive. None of those are going to be short term. You can do those for the long term. So you can see already, which I'm preaching to the choir because you know these things, and you practice these things, that's just one domain. But there are 6 domains of lifestyle medicine, and there are multiple domains of integrative medicine that you could take up an entire session of physical therapy, integrative physical therapy, just talking about the sleep domain. And that impacts how the body processes pain. It impacts growth and repair, inflammation control. So just changing that could really change someone's shoulder, someone's knee, or their pelvic pain.
No, you're absolutely right. And as you said, so like even in the clinic or if I'm helping someone outside of the clinic, because I know there is a lot work goes into it when you have to implement a lot of different lifestyle strategies to target so many different symptoms. But I always go for sleep first because even though I get to spend, let's say, 50 minutes to an hour with a patient one-on-one in the clinic, and we are still doing the exercises that we're supposed to do for whatever, shoulder pain or back pain. But we are, of course, also trying to navigate all the symptoms of perimenopause or menopause. And so this is what I try to do. As you said, we have like 6 different categories to go into. So every week I try to tackle one at a time. But sleep is always like my week 1, my first session, because if that gets regulated, everything else, like your brain fog, your mood change, your mood swings, your energy level and your pain perception, everything, stress level and basically everything. So no, definitely sleep is like my first area to focus on.
Yeah, I think that's so important. I would 250% agree. If we're not sleeping well, nothing is going well. It's like that
Can
old
you
adage, if mom is not happy, nobody's happy. And in Ayurveda, it is everything begins and ends in the gut, which is also true. But sleep is a huge part of that.
Ginger, personally, like Are you there yet? Like, have you started experiencing any of the symptoms of perimenopause?
Yeah, I actually had to this is an important point, I think, for women. There are 2 different ways you can really enter perimenopause, naturally or suddenly. And for
Distracting,
me,
yeah.
yeah, it's the suddenly is the harsh one. It's the hard one. It's like being told to, like, deep sea dive and you've never even swam in the shallow end of a pool. You're like, "Whoa, what just happened?" And I just want to, for the listener, if you are a female going through that, if you've had a surgical menopause or a medical menopause, it's like being in a car accident. It's not the slow motion kind of train wreck that people imagine perimenopause to be, because then it could be stretched out over 10 to 15 years. And I just want to emphasize that it doesn't have to be a train wreck at all if it's managed. And I think physical therapists are an ideal situation to be a primary manager of menopause, because not every woman is going to need hormones, but they can certainly, if they're menopause literate, they can certainly lead the charge on what is needed if your therapist is, menopause literate. So there's those 2 different ways are important. So we've got the slow progression into it, which is kinder on your body, of some time to adapt to what's happening. And then you have the sudden. And for me, it was sudden and forced. So I
Mm.
didn't even have an option. And to even consider what was going on at the time, because of what was happening, I also didn't have any menopause literate providers around me. So as I went through that sudden crash, that sudden train wreck, there was no one there to say, and you're going to need this supplement and you're going to need that, and you're going to need this. I had to figure all of that out on my own, which made me even more passionate about helping women get through the perimenopause menopause experience, because back at that time, no one was talking about what was necessary. It was like, oh, you'll be fine, whatever, you don't need anything. And that could not have been further from the truth. Fortunately, I was able to really, like, crash course learn what I needed to know about it because of having a background in integrative and lifestyle medicine. I knew that couldn't be possibly correct. And because of our backgrounds in healthcare, we knew to question that, because unfortunately in the United States, in the system we live in, you cannot be certain that when you go to a provider that they're actually going to offer you the best treatment that is evidence-based. It might
Of
be
course.
what they might specialize in, it might be the latest drug or surgery, but it might not be the best course of action for you. So I really credit that, again, just like with yoga, saving me. I credit having that, multifaceted background into stopping my progression through that change in life from being a train wreck. It didn't have to be. It started out that way when I was like, wow, this is totally unacceptable. And then empowering myself with what I needed totally changed that. So it made the transition the way it should be for every woman, more than humane, that they're well informed, that they know what to do when sleep is upset. They know what to do if digestion changes. They know what to do if they have vasomotor symptoms, because some of the most disturbing little pieces of information that we have really are motivators for any woman listening, or anybody listening who loves a woman and cares about women, should let them know this information that, for example, vasomotor symptoms, so hot flushes, night sweats for perimenopause, which can be postpartum too because of the drop in estrogen,
Mm.
are often, it's the most, how do I phrase this? It's the most common symptom that you can look back on and say that women had when they have dementia.
Uh-huh.
So the women that have worse vasomotor symptoms, in other words, are more likely to have that neurodegenerative situation when they're older. Honestly, I think that's probably one of the things that all people are probably most afraid of. Like, no one wants to be a burden on their family. No one wants to experience dementia at the end of their life. I think everyone on the planet would choose a different way to go than. And so when you look at the impact, and that women with worse vasomotor symptoms were more likely to have dementia and Alzheimer's, and we know that more women than men have dementia and Alzheimer's, it's very motivating to go, I'm going to be an empowered, informed consumer. I don't want that to happen to me.
It is. And sometimes someone who is also like having brain fog, then they can get confused with dementia versus brain fog. But yeah,
Mhm.
using all this lifestyle medicine strategies, help you with so many symptoms. And of course, HRT does have a role to play. It does have its
Definitely.
own place.
Yeah.
But even though if someone is on HRT, combining lifestyle medicine practices can make a huge difference in all the symptoms.
Yeah,
And it's
absolutely.
of course, lifestyle medicine practices, it's not easy fix. You have to be patient. You have to give it time for you to see some results. I always say that at least give it like 12 weeks max, and you should see things changing. Of course, before that, but some people respond differently. So, yeah, someone who wants to change not just the symptoms during this transition, but also who wants to lead a healthy life beyond menopause, lifestyle medicine practices can help them take them long way.
Yeah, you can absolutely thrive. My entire experience with it has been, and again, at first, because it was a medical menopause that the medical system that should be informing you about it completely left you in the dark and gaslit you about it. It
Hmm.
was very angering in the beginning, but it absolutely can be an incredible, empowering experience if you're with the right clinician. And so, unfortunately, I had to be my own right clinician and figure it out. And since then, I've built a team of people that I can depend on and trust for treating my patients as well, because it does take a team approach. We can't do everything alone. But, like, for example, just to give you one more listener's essential little piece of why ILM or integrative lifestyle medicine is so important is, for example, if we want to improve support liver function and improve estrogen metabolism and decrease those vasomotor symptoms. There are plant-based solutions for that. Cruciferous veggies are really great at that. The compound sulforaphane, which is found in broccoli sprouts, also really wonderful for that. Because as we age, the reason women have heavier, worse periods, more painful periods that can go on to make for really rough perimenopause, menopause is because we're more likely to add visceral weight gain as a result of estrogen metabolism problems. And we need to look at how to, like, what the root cause of that is. And one of the reasons is, as women, again, too, they're like, I didn't change anything with exercise or diet, and I still started to gain weight around my middle. Unfortunately, we do something called aromatization. Aromatization of estrogen happens more easily in tissue, especially adipose tissue, fatty tissue. And so that basically means the balance between progesterone and estrogen can really get skewed during that time, especially if there is weight gain. But the good thing is there are all kinds of dietary changes and plant-based even supplementation that can be used naturally, no pharma, no medication, no prescriptions,
Hmm.
in order to help improve metabolic function. Because if you also look at women's outcomes with menopause, there's weight gain, there's loss of libido, there's dyspareunia or painful intercourse, cardiometabolic syndrome, so heart disease, in addition to the weight gain, increased risk of diabetes, that kind of thing. All that is actually born out of that aromatization problem and metabolism problem that can be helped with ILM. So if you're listening and you are struggling with weight gain and you're struggling with libido and you're struggling with pelvic pain or back pain and you're not sure where to turn to and you've talked to your GYN, which, by the way, just because someone's a GYN doesn't mean they're menopause literate. Yeah. And if we give OBGYNs a break for a second, the other problem with saddling OBGYNs with all of this work is that for everything else, you've got cardiology, you've got neurology, you've got endocrinology, right? You have all of these specialties. And then there's one person for women's health across an entire lifespan, prenatal, postpartum, all the pathologies that can go wrong, menopause, everything. Like, one practitioner couldn't possibly provide all of that specialized care. And that's where we need, we're saddling OBGYNs with too much to do. If they're delivering babies, they should deliver babies, but they shouldn't also be saddled with also being an expert at menopause at the same time. We need GYNs who are experts in menopause, right? And then OBGYNs who would be from preconception, and they hand those off to, menopause specialists. But it brings up another important point, Vidhi, and that is physical therapists can also be menopause literate and experts. Nurse practitioners, PCPs, there are urologists, and women need to know that. There are easily at least half a dozen medical professions that could also be menopause literate. Now, every profession should, and I'll make one more point about why. The American Urological Association just released their clinical guidelines on for genitourinary syndrome, or GSM, genitourinary system syndrome of menopause. And in that, and I wish we could have shot this from the rooftops, in that they actually suggested, that was one of their recommendations, that even orthopedic surgeons become menopause literate, because their recommendation is that every woman going through hip replacement, she should be prescribed vaginal estrogen before surgery,
Mhm.
because it cuts down on readmission of hospital rates due to urinary tract infections and all kinds of things that happen.
Yes,
And it's
absolutely.
because of estrogen deprivation. And I'm like, hello out there. Are the orthopedic surgeons listening? Because every woman, if you look at what leads women to be admitted to nursing homes by their family, it's urological issues. It's incontinence, where they can no longer handle caregiving their female family member at home because of incontinence. And then, goodness gracious, we're not even giving women the basic stuff they need, like replacement of vaginal estrogen and also topical DHEA, that they actually need to thrive and stay out of hospitals and nursing homes from incontinence and UTIs.
Very well said, Ginger. And thank you so much for that incredible point of view on OBGYNs, because I never thought it like that. And what you said is 100% true, that they shouldn't be the only one who should be responsible for menopause care, because menopause doesn't, I would say, impact just one system, right? It impacts all these
Yeah.
different health systems. So I
Yeah.
think all specialties in healthcare, doctors or allied health professionals like physical therapists or other professionals, we all should, like take charge and try to give the best menopause care possible. Of course, staying within our own scope of practice. So thank you for that.
Yeah. Yeah, absolutely. It also is very supportive of everyone trying to do their best, because I think someone gaslit by maybe an OBGYN that says, oh, we don't do testing, or we just wait till you have symptoms. It also gives them, they're supported too, because they're overloaded. There's no way they can be menopause experts and baby delivering experts at the same time. And it points to the system as being broken, not that ACOG is broken or APTA is broken, because we all exist in a system that we have very little interdisciplinary education. Our insurance-based system is propped up on the number of interventions that are prescribed, not getting people better. And so again, we go back to that original full circle discussion of the values of integrative and lifestyle medicine, which is address root cause, find what's really causing the problem, and then empower the patient so they do not need that healthcare, service anymore. Well, that's not what our current healthcare system does, right? So if we can have a realignment of values, which may be super hard in a system that's profit based, and that's the problem with United States healthcare, then we could actually begin to really address and give people what they need. But in the meantime, even if you're working in an insurance system, even if you're private pay, no matter or if it's public health or pro bono work, whatever you're doing, you can absolutely integrate integrative and lifestyle medicine into any practice, any population, at any level, and have your treatments be far more effective.
Thank you so much for sharing all this amazing information. And before we wrap up, do you have like any recommendation in terms of frequency or duration for someone who wants to practice yoga, medical therapeutic yoga, or walking meditation that we were talking about, who doesn't have, of course, hours and hours
Right.
every week, but like what would be the weekly recommendation in terms of getting those health benefits?
So the cool thing about doing medical therapeutic yoga is, because it's aerobic, it's strength, it's endurance, balance, and flexibility, is that you could really actually meet your qualifications for the latest scientific guidelines if you did 30 minutes 5 times a week. That would be the minimum. And then the upper limit of that is doing an hour 5 times a week. Beyond 300, your benefits can start to decline. And that's when we're talking about people who, not to pick on ultra marathoners or, things like that, but we do know that athletes who really push their body hard actually have a decline in immune function, and they have more wear and tear. So there is a limit to how much exercise you actually need. But the good thing is, in terms of yoga activity, it can actually do everything you need in as little as 30 minutes a day, and it doesn't even have to be all at one time. 5 minutes here, 10 minutes there. The science has already proven in 2018 in the last lit review that it's cumulative. And in fact, cumulative exercise might actually be more effective than a single bout of exercise in a day.
And someone who is thinking about, let's say, stress reduction specifically, so reducing stress and sleeping better, who wants to practice, let's say, breath work or walking meditation, for example.
Yeah.
So for those women, I know you said that even 5 minutes of practicing stress reduction techniques can help you, but
Yeah.
do you have how much it should be like per week?
Well, that's a good question. I was just digging into the literature on that because the book chapter that I'm finishing up on integrative and lifestyle medicine right now that we were talking about before we hit record, there is no mandated effective consensus on that. However, what literature has observed, and of course, we can always say more research is needed, right? We need more systematic reviews, more meta analyses, more research all the way together, all the way around. Is that 2 to 5 minutes of whether it's breath work, mindfulness as meditation, walking meditation. And there's a dozen different types of meditation out there, and mindfulness is one of them. Breathing is one of them. Sound therapy is another one of them. Vocal toning, because of polyvagal theory and an improving vagal tone, also one of them. And so as little as 2 to 5 minutes has been proven effective to get objective changes. So that's all we have to go on right now, but that's pretty good if you only need to do that much.
Sounds good. That like seems like very easy to incorporate in anyone's busy schedule.
Yeah, absolutely.
And since we did mention breath work, if you can tell the audience a little bit, because I do see a lot of women coming in, and when we try to incorporate some breath work, the first thing they go is to try to incorporate their chest. So
Yeah.
if you can tell them, like, why, as a professional yoga therapist, why do we always encourage not to do chest breathing? How it like negatively impacts your nervous system.
Right. Well, I call it stress or pain breathing. And I was sitting in a piano recital yesterday where my son was playing, and one of the little kids came in and he was upset because he thought he was left off the list for the recital, but he wasn't. Everything worked out fine. But I saw him sit down, he was crying, and he was chest breathing. So he was stress breathing. He obviously felt pain. He was upset. He was crying. And he's maybe 9 years old.
Mm.
And so I want everybody you're listening. I want you to think about the first time at which you caught yourself chest breathing, and then think back to the first time that you might have done it and not been aware. Because if you look at a baby breathing or even a baby crying, they will still belly breathe
Yeah.
until the world has interfered enough in their psyche, in their mind, to make that breath switch from rest and digest, connect, to disconnect, disassociate, fight or flight. And it's one of the most profound ways to think about coming back to yourself with breathing, of belly breathing being the default. Watch your pet breathe when they're asleep. Watch your children breathe when they're asleep. They're going to breathe in the most organically perfect way that you've ever seen, as long as they're not in pain or stressed. But that's what the world changes for us. And that begins to wear us down over time. So I want people to think about the way they breathe, not as a product of what they're doing wrong and that they can't, or that they're ineffective, and instead how living in this world is a stressful, painful experience. And that's not your fault, especially as women, because you're already born into a system that values men more than women and that actively discriminates, and that we have a very high likelihood of being the victim of assault, domestic violence, etc. Very, very high probability. And we're guaranteed to be discriminated at work and paid less. So it is not about blaming yourself for anxiety or depression or chest breathing. It's about stepping back and looking at a system that you've been born into that was never fair to begin with. And if you do that, then you can shift toward getting out of the negative self-talk and the blame game and say, okay, I'm going to go back to that original, method of breathing, of belly breathing. There's also other types of breathing in yoga That's why I make my playlist for breathing free on YouTube. And on it's like master these breathing techniques first under the medical therapeutic yoga tab or playlist, because it's that important that we all return to belly breathing, because it reestablishes digestion, connection, rest and digest, all of the systems that we need in the parasympathetic nervous system that actually will ground us and give us the safe space to know that we're okay. Even though we can exist in a volatile, toxic, situation, you can still protect yourself in that way. And breathing is a main mechanism for that.
Thank you so much, Ginger. Thank you for explaining it. And thank you for sharing amazing information today and taking the time to talk to me to bring out this science-based information for everyone who is listening.
You're so welcome. Thanks for having me.
If you're someone who wants to use lifestyle strategies to improve the symptoms during perimenopause and menopause, then please check out my program. The link is in the description. And if you like this video, if you want to explore another conversation with another healthcare professional, then please check out this next video over here. Thank you.